Okay, so let's do COVID first. A couple of quick updates. Supposedly, government still has those free kits. However, my understanding, they're nowhere to be found, so don't look for them. Basically, our only choices at this point for the testing is to go to the local pharmacy and buy some. If you are concerned about your lung function and you're worried about getting more of a pulmonary symptoms, I think getting the test is the right direction. So the tests that do this RSV, flu, and COVID all in one shot. Unfortunately, they're much more expensive. They're starting at $30, but they're really closer to $50. Sometimes you can get like 2 for $50. I've seen that, but they're much more expensive. The COVID, when you buy a multi-pack, you can get the cost for about $12, $15 a piece, but the price is variable quite a bit. So that's a little update. Second update is a little upsetting. So the Novavax did not get FDA approved. They basically just delayed approval without saying why. And it causes significant concern. If the Novavax doesn't get their DNA vaccine approved, it means in the fall they will not create the updated booster. It's officially still can be used under emergency authorization, but they will not be able to make the new batch with updated strains, which are expected to come out for the fall. And that to me is quite frustrating because I'm basically discontinuing recommending any mRNA boosters, period, for anybody. So my idea was to go only to Novavax and recommend it to everybody for boosters, but I'm not going to be able to do that unless something changes. It's not a final decision. They're basically just saying we're not approving it now. They were supposed to approve it last week and they didn't. They just pushed it away, and it's not clear what the timing is going to be. So those are my 2 COVID news. I don't have any other COVID news, so let's do Q&A. And I will be home in 5 minutes. So once I'm home, I have a little topic that we're going to cover until around 2:30 as usual. But Janet, I'll need your help on this since I'm not going to even try to read the chat. And I'm sorry, everybody, I'm still in the car. That's because I was giving a lecture at Children's Hospital on inflammatory bowel disease, and I got overexcited and started talking to everybody. And next thing I know, I was late, so apologies. That's why I'm in a car driving.
Jen, I can't understand what you're asking, so just unmute yourself and ask.
Oh, okay. That's because I can't type and, anyway. My question was, has anything changed to change your recommendation against getting any RMA? I know that you had expressed.
Yeah, there's just an increasing amount of data on autoimmunity following the shots. And there's some molecular mechanism that I'm starting to grasp a little bit better, which are even more concerning. So it seems like that basically some of those original concerns of a hyperactivation of immune system are really true. No, COVID cases are not, they're pretty flat. They're not rising. In fact, most of the areas of US seeing a drop, but it's very trivial drop. So basically the virus is just kind of percolating out there slowly. I had a patient last week, I think, test positive. So it's definitely here. It's just very little of it. I think actually what I'm seeing more is some kind of a really, really nasty gastrointestinal virus, which unfortunately is not getting diagnosed. It's like patients would go to urgent care emergency room, they'll get the typical viral stool test that comes back negative, but the symptoms clear up after 7 to 10 days. So I don't know exactly what is out there. I think there's a question.
Oh, let me go. Okay, will you describe the difference between immunology and rheumatology, please? Thanks, Rona.
Well, rheumatology is a medical field of joints. So they deal more with inflammation of joints and muscles. And endocrinology is much more of like a hormonal, immunology is much more of an allergy field. So immunology typically treats allergic reactions. It treats poor immune system, like immune dysfunction when the immune system is down. And rheumatology is pretty much deals with long-term inflammatory conditions such as rheumatoid arthritis, lupus to some degree. Well, actually, lupus is rheumatology. Osteoarthritis, those are the rheumatology. Immunology will deal with asthma. Immunology will deal with frequent infections due to downregulated immune function. And of course, immunology will deal with direct allergic reactions, like people who are getting immunotherapy, whether it's a sublingual or shots, allergy shots, that's an immunology office usually.
Okay, we have another question. Are COVID cases still rising? Here in New Jersey, the biggest concern is the measles outbreak.
No, so I would say, as I already mentioned, I think they're pretty flat. I am not worried about measles even a bit. And the main reason is most people are protected. Most people are vaccinated. If you're vaccinated, if your immunity has not been boosted, chances are you still have some mild partial protection, but you probably do want to follow the recommendations on this one, which is go get yourself tested if you have any questions. So basically you run measles antibodies. If they're low, you go get a booster. If they're high, that's normal, that's what you want, and then you don't have to do anything whatsoever. And remember, we also, there's a little bit of a hype, right? So the mortality from measles is tiny. Morbidity is somewhat, but it's pretty much not that far off of shingles in terms of morbidity and mortality. So yes, occasionally there are really catastrophic consequences, but most people will have a very mild disease. Now, adults will have a severe measles compared to kids. So that's why, it's more important for adults who are at risk to know their status. So if you're, and there's a brackets, which I don't remember top of my head. So let me take a pause because I'm transitioning to the house in a second. So I'm gonna just turn off the video for a minute here while we screening for the next question.
Okay, while you do that, I'm going to drop the partners page for the GW Center for Integrative Medicine. That's the page that Dr. Kogan said you can find information on their partners, including the company that does the vibration plate. But please remember, they got their last shipment stolen. So it may be a while until they can service any orders. But there you go. That is the partners page. Now, hey there. So the next question is from Al. He says the autoimmunity issue with RMA vaccines is interesting. Would you be able to do an updated talk on your findings, especially for those who have concerns with autoimmune conditions? So
No.
in the future, could you do that?
No. And the reason is I don't understand intricacy and no one will. It's too sophisticated. Basically, if you don't have a PhD in immunology, you will have really hard time understanding. My understanding of it is still, basically, if you don't understand the difference between Th1 and Th2 reactions and between some of the leukocytic triggering, it's pointless because the details are so fine and so deep in the weeds of the immunology that I'm not qualified to talk about it. So the reason I'm seeing this, I'm following some experts who are able to discuss this. I can't be confident enough that I'll be able to explain what they're saying. So again, it's the difference between a clinician and the actual scientist who understands the intricacy. So some of these immunologists understand what the vaccine, what mRNA vaccine is doing on a certain level versus the older technique, older style vaccine, and that's I just don't feel comfortable. And even if I somehow figure out how to present it and simplify it, I'm still not sure it's worth it, because point being is we're definitely seeing an uptick in autoimmunity out there as a result of the vaccinations. But what is the true significance of it long term? We don't know. My way of operating has more to do with the European style. I will recommend something only when I'm guaranteed safety. And in US, remember I mentioned this before, right? So EU will not approve a chemical until it's proven to be safe. US will not remove the chemical from the use until it's proven 100% that it's harmful. It's a philosophical difference. So I'm siding with the safety first. US is siding with proof the toxicity first. So let's produce the life-saving intervention or some chemical that will save us billions of dollars or whatever. But then we will deal, if there is a fallout of that with a toxicity, we'll try to learn this later. That's the default of how US operates. And that's also the default of the Environmental Protection Agency here in US. So they're tasked with proving toxicity. They're really not tasking the industry to prove safety completely first. With vaccines, it's not even possible. How are you assessing safety of something 10 years from now? It's not biologically plausible. You have an emergency on your hand, and you have to deal with this. So, but now that emergency is over, I'm beginning to get more and more conservative as time goes forward. And we are seeing less of this autoimmunity with Novavax. There is an increasing number of studies showing that. But it's a very subtle difference. And if you ask most experts, they say there's probably not enough difference to worry about this. And I disagree with that. That's all. That's all I'm going to say for that. So, all right, I'm going to try to get in. I still have about 15 minutes, right? Because I still want to talk about sarcopenia today. So sarcopenia is muscle loss. And I was going to show you a couple of details on that. But meantime, if there's a couple more questions, I can do that, and then we'll switch to my laptop. So just pay out lawsuit after the. Okay, so we're not talking politics here. Statistically, but yeah, Alice, 100% right. I'm completely with you. I'm also just thinking that that will eventually gonna start happening. I'm always predicting litigations moments because it's happened in the past. Could the problem? Yeah, of course. So Linda, that's exactly right. So there are definitely going to be some predisposition. They're just not. One second. All right. So it's just not really clear what those exact predispositions are. Like, how do you prove that this person has predisposition and this doesn't? My guess is in the future it'll be genetic testing. Like, we will have this basic personalized genetic assessment that's going to say, okay, this person is okay to get mRNA, this should not. Like, but it's completely not yet out there. And I will not venture to say that I understand enough to say something. So I have to play safe, and basically, if you're going to get a booster, try to get non-mRNA. That's basically going to be my statement, but I have no idea what I'm going to say that comes fall if the feds will not approve Novavax, because we will not have a choice. We'll just have Pfizer and Moderna, and they're both mRNA. Okay, so let's do 10 minutes of Janet, can you make me a co-host so I can put the slides up? Right. So okay, so talking about it's still off. Janet. No, she's still here. Janet, make me co-host so I can share the slides. Okay, I'm gonna talk about, while she's figuring this out, I'm gonna just talk about what I was gonna show you. So sarcopenia is a term for a muscle loss. It's one of the most important topics in geriatrics. It happens to everybody. Somewhere past age of 75, the muscles begin to gradually decline in strength. Now, sarcopenia is a specific medical term. It means that the muscle mass decline is pathologic. It means it accelerated and it's faster than you would expect, or that it's simply the muscles are too weak. There are very specific diagnostic criteria for sarcopenia. I don't want to bore you with the specifics, except to say that there's some very simple screening tests. For example, you can see how a person gets up from the chair, how they're rising, how fast they're rising, and how quickly they can go up and down the stairs. So some very basic things. But there is a lot of really interesting, again, I'm waiting for Janet to let me do the sharing. So once I'm able to share, I'll show you. So there's no real clinical obvious test for it, except that we're working on one. So I'm not involved in this study, but some of my geriatric colleagues at GW just developed recently DEXA-like scan that assesses whether you are at risk for sarcopenia or not. So it is a study, you get paid, you get this free test, and they will tell you whether or not you have a problem. I think this would probably in the next 5 years will become a standard of care, because we really need a screening test. Doing questionnaires in the clinic is always much more difficult, and obviously you also cannot follow that up. So having an objective imaging that is low radiation would be very, very attractive for this topic. In research right now, there are tests that are assessing sarcopenia. They're either MRI or some other imaging, but those are purely research and they're too complicated to do on a routine basis. So that's the definition. Now, sarcopenia will lead to frailty. Now, frailty is a functional term. It means that a person is not able to perform certain tasks, that they're frail. That's just almost like an intuitive concept, right? Now, the difference is that while frailty and sarcopenia both are syndromes, they're geriatric syndrome, frailty is much larger syndrome. Frailty could also apply, it doesn't have to apply to muscles alone. Frailty can apply for general deconditioning. It can apply to other organs being frail. So person could still have a little bit of muscle mass and could have very mild sarcopenia, but could have some of its organs very frail. And then we would still apply concept of frailty to such a patient. Why both conditions are important? Well, they carry a horrendous mortality and morbidity link. Anybody with frailty or sarcopenia, life expectancy is 12 months, unless you can reverse it. So unfortunately, both of those conditions are pretty much, predictors of passing, in essence, if you will. And frankly, if you think about this more intuitively, those are the conditions that towards the end of life occur. Muscles gradually deteriorate, person starts to have less and less muscles, and that applies to the whole body, not just to the musculoskeletal system, but to everything. So, and that is for what the sort of the terms are. I guess Janet disappeared on us. All right. I'm still not able to share, so I guess I'll have to keep talking through it. So how do we treat sarcopenia? The current standard of care for sarcopenia is optimizing protein intake. You get up to about 2 grams per kilogram per day, making sure your vitamin D is normal. And if there are any other specific nutritional deficiency like vitamin B12, you have to fix this. You have to maximally deprescribe, so you have to decrease the number of pills you take, because the number of polypharmacy is strongly linked to the sarcopenia and frailty. The more people okay, thank you. Okay. So let's start from this slide. Basically, the more pills one take, the more frail they're going to be. There's a strong link between polypharmacy and frailty. And then the stimulation. So stimulation is interestingly really, really important. Stimulation is critically important for the brain and brain frailty, but it's also really important for the muscles. So that's a standard of care. Now, if you look at additional integrative approaches, these are the things that we add. To definitely treat hormonal deficiencies, we give a lot of frail and sarcopenic patients testosterone. It's actually one of the few things that could be rapidly effective. Definitely, you would want to reverse inflammation. And then you have this list of supplements. So creatine, 5 grams per day, CoQ10, somewhere between 100 to 200 milligrams, basically more of ubiquinol than ubiquinol. Lion's mane is a medicinal mushroom. Make sure that the powder comes from a very good source. My preferred one is Host Defense, which is the Paul Steinmetz's brand. Fatty acids, a couple grams a day, 2 grams would be good. Now, urolithin A is also named, the brand name is Mitopure. Very expensive supplement, will cost you somewhere close to $100 a month, maybe 75 or 80 with just some discounts. But there isn't a growing evidence. In fact, I have even a whole YouTube video on urolithin A, including what the studies and why and what the dose you should be taking. And then food-based probiotics. So this is the typical integrative tools for sarcopenia. So I'm going to stop sharing because that's the only slides I have. And I want to stop here and see if we have a couple of minutes for last couple more questions before I hand it over to Catherine. Okay, let's see if we got, oh, I was promising you link to the study, right? So I'll do that in a second. No speaker will address this, I can guarantee you that. The only few people I have seen who were willing to talk about this, the moment I said, could you come to a public forum, they said, absolutely not. It's too controversial. No one in academia would want to basically contradict the narrative. So it's going to be really hard to find anybody who will give us, and because remember, that person also has to give it in a general, understandable way. The people I'm following on the media who are discussing this, they're discussing is at the level, 10 levels above Peter Attia. Like it's so scientific that I don't understand 80% of it myself with a medical degree. So that tells you something. I mean, it's too deep into weeds of immunology, and I'm just not comfortable with navigating that. Because I also, in that sense, I also don't know who's good and who's not good. So getting a person would be really difficult. Why is frailty such a strong predictor of death? Well, let's put it this way. You have to use muscles for every function of body. Pretty much every function you can think of is going to engage the muscle structure one way or another. So when the muscle structures become so frail, basically one of two things happens. Either some kind of a fall that leads to a catastrophic trauma, like a brain bleed or some hip fracture or something like this. Or there's simply such a profound deconditioning that once you stop moving and you end up bedbound, then you only have a few months to live. It's sometimes people live quite long, but if you go back in time, you will realize that they became frail very much younger. So if somebody becomes frail from acute infection of some sort or some other acute illness in their 20s and 30s, they can live for a long time. The body will adapt. But if you're going to become frail at the age of 85, you probably have 12 months, maybe a little bit more. Again, unless you can reverse it. And there are techniques that I just discussed. But that's a good question. Yeah, I now recommend creatine to a lot of people, 5 grams to almost everybody. The only real contraindication in my mind would be if you have some kidney problems, you would want to discuss first with your provider whether it's safe or not for you. But if you're my patient, of course, just ask me that. Okay, so here's the link to the study. So if you want, you can just contact them. You have to be 65, you have to be able to walk, you have to be able to be willing to take the DEXA scan. It's basically the same amount of radiation, just like you would do a bone density scan, which is very low radiation. Yes, resistance training is great for prevention of frailty, absolutely. Collagen is not a very good source of protein. It's a very good source of support of the collagen structures in our body. So particularly, we're talking about tendons. tendons, but muscles and hair and skin. But it's really not a good source of protein. You're not going to get enough. General dose of collagen is like a scoop, which would probably be about just a couple of grams of protein in there. So it's just not, it's not sufficient. If you're looking for more protein, you'd be way better off with either a whey, or maybe if you don't want to do anything milk-based, then something like a hemp or a pea protein would be more, if you're interested more in plant-based source. All right. Yes, so resistance training can reverse sarcopenia and frailty, but only when the frailty and sarcopenia is induced by some kind of an acute or semi-acute event, subacute event. If it's just due to gradual aging, no, you can only slow it down. You will not be able to reverse it. And again, if you just have been a couch potato and you at age of 65, somebody told you, oh, you look like you have sarcopenia, and then you start exercising, yeah, you can reverse that because you have never tried to address this. I'm talking more about 80s and 90s when the body has been robust and slowly declining. I would say no, not at that point. It's a great question, actually. Probably one of the most important questions. All right, Jennifer, keep rising.
Where's the supply link in the applying link in that website? Because when you click on
there's no applying link, you have to send an email, you have to call. There's no, not like you can't apply online. They want you to get hold of them because they're screening you on the phone.
Okay, thanks.
All right, well, I don't want to still, unless there's last burning question, but too much protein. Yes, so you could take too much protein, but it's generally not as much of a concern. If your kidneys are normal, I wouldn't go above 2 grams per kilogram, but trust me, 2 grams per kilogram per day, that's a lot of protein. Like if you think about what you're eating, for an average person, let's say 70 kilograms, that's 140 grams of protein. Very few people will consume that much, I will tell you that. Most people will consume way under 100 grams. So, well, Catherine, thank you so much. It's always such a joy to have you here. Everybody, of course, know you really well. Janet already introduced you. So let's make sure we pin you to the screen, and thank you.
Thank you for that talk, Dr. Kogan, and good afternoon, everyone. I hope y'all are doing well. Despite the rain and this cold week we've had, I think next week's weather, or maybe the week after, looks like it'll be better. But as we begin, or before we begin, I invite you all to get into a comfortable position. You can be seated in front of your computer. If you want to go to your couch, some spot that maybe is a little more comfortable. I always invite folks to get any supports that they may need. It can be pillows, blankets, a cozy sweater. So I'll give you all a minute to get settled wherever you are. Wherever you are, I invite you to begin to first turn your attention to your breath. And allow yourself to take a deep breath in through the nose and out through the mouth. Breathing out your day, breathing out any stressors from your week. Let's do this a couple more times. Deep breath in through the nose and out through the mouth. And again, deep breath in through the nose and out through the mouth. Allowing your breath now to return to just a very normal, gentle pace. Just notice without judgment. how your breath feels. And as you continue to breathe, we're going to move to a bit of a progressive relaxation exercise. So I'd like you to draw your attention and awareness to your hands. Just notice how they feel right now, wherever they are. You don't have to move, you don't have to do anything. Just notice your hands. And maybe begin to make a fist and open your fingers. Maybe notice what that feels like in your fingers and in your palms. And then make a strong fist in your hands. Maybe begin to feel a little bit of tension in your hands, your muscles engage. Maybe notice if you feel any sensations in your wrist, your forearms, your upper arms. And begin to tense the whole hand. And if it's available to you, tense your whole arm. And breathe in as you hold that tension. And when you can't hold your breath anymore, exhale, let the breath go, let the arms relax and soften. Sigh it out. Breathing gently. Notice your hands and arms relaxed. Now I invite you to bring your attention to your feet. Just notice them as they are. Maybe begin to curl your toes and release them, noticing what that feels like in your toes, in the soles of your feet. And as it feels comfortable for you, I invite you to curl your toes and kind of hold that there. Again, feel some tension arise in your feet. And if it feels comfortable for you, maybe bring in some tension to your calves, to your upper legs, maybe all the way up into your glutes. Feeling your whole lower half tense up as you hold your breath in. Hold it in, hold it in, hold it in, until you can't any longer. And exhale, let it all go, sigh it out. The whole lower half relaxed and released. Breathing in and out. We'll bring our attention out to our face. Just noticing your face. Notice if maybe your jaw can relax, even 1%. Your cheeks can relax. Your forehead. And as you breathe in here, I invite you to now bring tension into all these places you relaxed. So maybe begin to scrunch your face up together, your nose, your lips, your cheeks, your eyebrows. Sometimes children make this face. Imagine yourself as them, bringing tension to your whole face as you breathe in and hold your breath, hold your breath, hold your breath. And exhale, once again, soften. Face softened. Now we'll put it all together as you're ready. Once again, bring tension into your hands, your arms, your feet, your legs. your face, maybe even your abdomen and torso if that feels comfortable for you. And we're going to bring tension to the whole body as we hold our breath in. Hold it, hold it, hold it. As we so often feel like we have to do in life, trying to hold it all together. And I invite you here to let it go. Let it soften. Continuing to breathe in through the nose. Exhale it out. And allow your attention to rest on your breath. Just notice and be aware of your breath once again. Do you notice if you're breathing a little more deeply? Do you notice if you're breathing into your belly just a little more? And in this next moment, I invite you to get a little more comfortable where you are. We'll move into a visualization. Continuing to breathe, and I invite you to imagine yourself in a place that feels safe, that feels comfortable, that you love. Maybe it's a certain space in your home. Maybe it's in a place from your childhood. Maybe it's in a place you've seen in a magazine or on TV. Maybe it's a place outside. Just imagine yourself there now. Notice what it feels like to be in this space. You begin to look around. Just notice what you see around you. Are there objects? Are there other people or other beings, plants, animals? Take a moment to notice the picture, the images that surround you. Notice the colors. Are they vibrant? Are there a lot of them or just a few? All answers are acceptable here in your space. Are there any sounds that you hear? Maybe is there music playing, birds chirping, ocean waves, people talking, or is it silent? Allow yourself to be fully immersed here. And wherever you are, in whatever space you're in, I invite you to explore it a little more. Maybe you're seated and just look around a little more deeply. Or maybe you choose to walk around in the space, touching things, just getting to know this space that is safe and that you love. Wherever you are, I invite you to imagine a plant. Maybe it's a potted plant. Maybe it's a plant outdoors if you're outdoors. Maybe it makes no sense that there is this plant in your space, but here, there is one. And envision that this plant represents something important to you, maybe that you'd like to grow, maybe that you'd like to transform currently in your life. Allow it to be represented by this plant. And taking a little bit of inspiration from the rain outside, envision yourself watering whatever this thing is. Maybe it relates to your work. Maybe it relates to yourself, to your body. Maybe it relates to another person or a relationship, whatever it is. Maybe it's an idea you have. Spend the next few breaths watering it. And as you finish watering it, putting your little water bucket aside, just sit with the plant. And envision what it looks like as it grows, as it's nurtured. You see whatever that thing is growing, expanding, coming to the fruition that you seek to see. Even if it's a seed, maybe it's a baby plant, whatever it is, take a few moments just seeing whatever that is come to life in the way you desire. Continue to breathe, continue visioning. And we'll begin to say our goodbyes to our space and to that plant, whatever it may have been. Knowing that you can always come back to the space, you can always come back to water, to nurture this thing that you seek to grow whenever you want. Allowing yourself to sit with it whenever you want, maybe for needed inspiration and guidance. And as you do so, begin to deepen your breath. Notice your belly and your chest rise and fall just a little more. Bring awareness to your hands and to your feet. And whenever feels good for you, I invite you to bring small, gentle movements into your fingers, wiggling them ever so slightly. small, gentle movements into your toes, moving them in a very gentle way. And expanding that movement, still gently, into your wrists, into your ankles, reawakening our body. And as it feels comfortable for you, making any bigger stretches, maybe stretching your arms overhead or out to the side, feeling your chest expand. Maybe gently moving your head side to side. You're bringing some movement into your shoulders, drawing them up, down, and away from your ears as you breathe. Maybe even some gentle movement in your spine. Gentle twist, spinal circles. Last but not least, whenever it feels good for you, gently begin to open your eyes. Taking your time, there is no rush. Reawakening whenever you feel ready. Thank you all. Hopefully this was a nice little break from your day. Step away from our responsibilities and take several moments to just build a little bit more awareness with our body, connect with our body and our breath and our mind. Who are things that are always with us that sometimes can get forgotten. So thank you.
Thank you, Catherine. This was delightful. Now I am so relaxed I can't find my glasses. Oh, there's it. Well, maybe somebody have a question or two for you. Otherwise, we'll say goodbye to everybody. I'll stay here as usual for 10-15 minutes if anybody needs to talk to me personally. Next week, I won't be here. I may actually join depending on how a schedule works out. It's kids' spring break. We're going up north to try to catch lost snow. But we have a special guest, someone Catherine knows really well. Luann Jacobs is going to be with us. I'm not sure what Luann's going to do, but yeah, so she'll be with you, and I'll see you guys the week after if I don't.
And Chris Palmer will be back with us.
Ah, great. Do you know what is he going to do?
Let me go and look at my notes.
Because we did a personal ethical will last time. So I suggest you guys all bring advanced directives questions to him. And if you haven't done your own healthcare next of kin and advanced directives, that would be a really good time to ask him questions and consider doing one. If you're in Maryland, District or Virginia, you can Google this term called 5 wishes. It's actually paid service. It's like $35 to download the form itself, but it's very cohesive and it's easy to fill out. So you may want to, it's advanced directives. It's just the specified advanced directives that are accepted across TMV area. It's accepted in other states as well. But for those of us who locally here, that's the one we recommend through the GW. And with that, I don't know. I don't see any questions for Catherine. I think everybody is zoned out in a good place. And they can go ahead and enjoy the rest of their day. And it's gonna rain, I think, the whole weekend.